And hi again, everyone. TJ Alds, I-45 now. Welcome to the next edition of Healthcare Unmasked, presented by UTMB Health. So glad to have everyone along today. A very important topic. June is Men's Health Month, and coming on with us is two foremost experts on that from UTMB Health. We're here to debunk the myths and also encourage all you guys out there who have not been going to see your doctor. You know who you are. To make sure you're getting out there to join us to answer some of your questions today. And as our promo said ahead of time, your wife has already said it's okay for you to take part in the show here today. So, in fact, most of your wives are telling you to be a part of that. Not needing their wives' approval to come and join us, though, here today. We are glad to have on with us Dr. Laith Alzweri. He's the Director of Men's Health and Assistant Professor of Urology at the Division of Urology at UTMB Health. You see him there at the bottom of your screen. And also Dr. Alberto Guitterez. He has completed his medical degree at the University of Vermont College of Medicine, and his residency was at UTMB. He worked as a faculty at Vermont Medical Center in 2016 before joining the faculty at UTMB in 2018. Focuses on outpatient care and preventative services. Thank you both for coming on with us. We do appreciate it. And what is a very important subject matter. And Dr. Guitterez, let me just start with you here on this, because this is something that it comes down to this is that it comes down to really most guys are afraid to talk to their doctors about the problems they're having. How do you as a physician deal with that? Because you got to get over that first hurdle to talk about what's going on in someone's lives, to find out if they have something wrong, and if so, how to take care of it.
TJ, anytime somebody comes in to my my clinic, I always start with just a conversation. You know, I ask them, what brings you in? How did you end up in here? We were joking that, yes, very often they tell me that their wife told them they have to come. And that's fine. I hear it all the time, you know, but I always spend at least 10, 15 minutes just trying to get to know you. You know, where do you live? What do you do for work? What's going on in your life? You know, do you have kids? What are they up to? All of those things, just to try to get people to be at ease. But then we get right into it. You know, I ask them, when was the last time you went to the doctor? And you hear a mix of things, you know, but just like you're saying, very often they do say, you know, I'm just here for a checkup. Haven't been to a doctor in 10, 15 years, you know, just wanted to make sure that I'm okay. And other times they come in because something's gone wrong. Something has changed and they feel like they can't ignore it anymore. And we need to address that. Mm-hmm.
And again, if those of you just joining us, this is Healthcare Unmasked presented by UTMB Health. We're talking about men's health, and we're going to debunk some of the myths, but also encourage you to get to see your doctor. No matter where your physician is, it's so important out there. And if you have questions, you can ask them by submitting in the comment section here. We'll get the answers as best that you have with it. You, Dr. Guitterez, you had said at the start that a lot of times the guy goes, my wife is making me come here. Yeah. One of the things you and I had talked about before is that we see in some statistics that men's health in certain areas are higher than women and that. And I asked you this before. I wanted to hear your answer again on this, and so that our audience can hear it too, is that how much can that be attributed to the fact that guys are not coming in as much or not discussing as freely with their doctor what's happening in their lives, that maybe that's why we're seeing some diseases and some ailments that are further along with a man by the time they actually have caught up with them.
Yeah, no, but absolutely. That has everything to do with it. You know, men are either they're afraid of hearing bad news, you know, or they don't want to hear that their blood pressure is high, or they don't want me checking their labs to find what's going on. But, you know, men are bigger risk takers. They're also more likely to drink alcohol, to abuse alcohol. Same goes with tobacco. They make riskier choices in general. And just a number of things that we can get right into. And I try to be very non-judgmental. In fact, I'm always very non-judgmental. We just tackle those items one by one. And during that initial visit, we're very methodical. You know, we take it from the top. We start with your vitals. We go through your history. And we always identify things along the way. I always just tend to just move along, sort of put a pin on things as we're discussing. all the items that they're interested in. And there comes a point in the conversation where we can really sit down and just go back and just start to touch on those things, one at a time.
And some of those things you get into right away is like, what have you been diagnosed with? And these areas of hypertension, high cholesterol, and diabetes, these are the areas that you really want to focus on with men particularly, correct?
Well, those are the biggest ones. Right off the bat, if somebody hasn't been seen in a while, as soon as we get their vitals, they might be nervous to see that their blood pressure is running a little high, And the thing is, they don't know why their blood pressure is high. They might have an idea. They might know that they're not taking care of themselves, but they don't know what processes might be going on in their body to explain why that number came out the way it did. And one of the things that I put a lot of effort into is just breaking that down. I tell them, look, your blood pressure can be high because of these reasons. Maybe they apply to you, maybe they don't. Let's talk about them. High cholesterol, that's another thing, very common. I just tell them, as you get older, your liver just takes the food that you eat and decides to turn it into different forms of cholesterol. And some of it is good for you, but a lot of it will start to build up into plaques in your arteries, and it can create some problems. Diabetes is a very common one. A lot of men out there, they have developed a degree of insulin resistance, and that's really what it is. And it's amazing. I get patients all the time who have had a diagnosis for diabetes for years. Maybe they've been treated with multiple medications. Maybe they're already on insulin, and I ask them, well, why do you have diabetes? What's wrong? What changed in your body? And even people who've had the condition for decades are not able to answer that. Very often they can sort of give me some semblance of the right answer, but it's very important for me to just pause and take a step back and really break that down, because when you explain to people what's going on, it sort of demystifies it. It makes it much more easy for them to take control, for them to take your suggestions and realize that, oh, well, if that's the problem, then by taking these few steps, we can make all the difference.
Right.
And that's been very rewarding to see.
And it comes down to communication. And communication is a two-way street out there. Here's one particular area in communication that comes in that I hear this a lot. If there are a lot of folks with men, particularly, it's like, about their medications, for example. They've come into their doctor before, they've been told, okay, here's your here's your hypertension meds, or here's your cholesterol meds and the like. But then they don't stay on the pattern as much as they should. They get off them. They don't even know when they run out. And that becomes a pretty big challenge, does it not?
Oh, absolutely. So the most common thing I hear is that, oh, well, I ran out of the medication and I didn't have any refills left, so I just stopped taking it. And that to me basically says, well, this medication had a purpose, and I don't think you really understood what the purpose of it was. Maybe it's for your cholesterol or for your blood pressure, but you're not actually understanding what it does to your body to help fix the problem. So I always take the time to explain that as well. Other times I also ask, are you taking any supplements? And that can clue me into some of the things that they're worried about. You hear about these like T-max, testosterone, type things, or they'll start taking fish oil, things that alert me to the fact that they do care. They're just not sure how to go about it or how to manage it.
Right. And then the other part of it goes into, and you talk about, you have that general conversation, and then you want to go ahead and get it narrowed down. And one of the ways to do that is just get the basic blood work, right? That's where it kind of starts. After you've had a conversation with them, is let's go get that blood panel. Let's go find out. And that's where you can start seeing, here are the areas we need to discuss.
So I will always do the intake. And honestly, the history is the biggest part on the first visit. I will, of course, examine them, and most of the time they're actually okay. Their heart sounds fine, their lungs are clear, nothing is overtly wrong. And I tell them, look, I'm not alarmed by anything I'm seeing. Let's just go ahead and get some blood work. Let's see if your chemistry and your blood panels and your cholesterol are all a reflection of how well you're feeling or how things are going. And if things are not looking so good, then we'll talk about it. Now, all of those labs that were listed on the slide, they are pretty basic, but they provide a lot of information, and a good doctor will know how to read in between the lines. You know, there are some things that are in those labs that can really let me know that maybe some of your habits are more out of hand than you think. People who consume alcohol in excess, for example, on their complete blood count, the size of the red blood cells will be slightly elevated. Maybe their liver function tests start to bump up. Their platelet count can also start to drop a little bit. Sometimes their sodium level tends to run a little bit on the low side. So it's very helpful. It really is, you know.
And it comes into, there are certain kind of age markers where you want to start looking at certain things here. And and this is a chart I would like to give to every man that's out there. Because this was actually, what you sent me here looked very familiar with me, because my doctor did the same thing the moment I turned 40. I got a similar chart. Like, okay, here's what I want you to do over the next 20 years and come in for these tests. It's actually pretty simple, but it's a good guide.
Yeah.
And she called it the playbook, I guess,
Right.
to kind of go to the sports vernacular to kind of feel. And I understood that right away. Can you talk about this? Because, you know, we've heard about cholesterol checks, but when should we be looking at certain things to come in?
Yeah, absolutely. So this is actually a very simplified version of what we're looking for. When men come in, it does matter how old they are. Usually they're in their 20s or their 30s. They just want to get established. They want to make sure they have somebody they can reach out to in case they get sick, in case they're not feeling well one day. It's very rare for them to have chronic medical issues at that time, although it does happen, especially with diabetes and such. Now, when you turn 40, that's when the visits start to become an annual thing. When you turn 40, some of the formulas that we use to estimate your risk of cardiovascular disease actually allow you to put in your age as one of the elements. And it helps us to estimate your risk moving forward. It does make sense to start checking your cholesterol at least once a year. We want to make sure that your vaccines are all up to speed, okay? There's not too many at this age. We make sure that your childhood ones were all done, but we do want to make sure that your tetanus shot is up to date. Those are every 10 years. The annual flu shot, every doctor will always recommend it. And obviously these days, the COVID-19 vaccine as well. Now, when you turn 50, I get my patients coming in, I tell them, well, congratulations on making it to 50. I do have a birthday gift for you. And that's when we start to talk about the colonoscopy. Now I've been doing my job for about 8 years, so I've gotten pretty good at convincing men that it's an important thing to do. Sometimes they're very resistant, though, and we talk about some alternative methods that we can use. There are some stool studies that we can send out that can be reassuring or can let us know that at least over the next year things are probably okay. Right around age 55, if men have been smoking for a fair amount of time, right around a pack a day for maybe 20 years, then it may start to make sense to do some lung cancer screening. And we do that with a low radiation CT scan. Very straightforward. It only takes a few minutes to do. And honestly, if you've been smoking for that long, usually there's a voice in the back of their head that's saying, maybe I ought to get that looked at. This gives us a picture of every square inch of your lungs, and we'll be able to know if anything's up. The shingles vaccine starts to be a recommendation. I always tell people that it can cost some money, although before the age of 50, before the age of 65, it is paid for by most insurances. But if you did get shingles and you could pay money to make it go away, you would do so really quick.
Right. I've had several good friends, older friends who had gotten shingles before. And after seeing them suffer through that, you can bet the moment I was told, hey, it's time for you to go get your shingles vaccine. Right. I was in line rolling up the sleeve both times for both shots. I mean, I was asking to say, hey, can I get the second shot now? It is one of those, that, you don't want to go through what comes if you don't do that.
Okay. Sometimes we start talking about the PSA. In fact, right around 55, we also start talking about the PSA. Now, the PSA is a big topic. I take it Dr. Alzweri might open up a little bit more about that. I do have my version of a story that I like to give my patients. Maybe we can come back to that at some point. When you turn 65, you are due for a few things. Again, we do want to make sure that your pneumonia vaccines are all up to speed. And if you are a man who has ever smoked, really just about any amount, we do like to do a quick ultrasound of your abdomen, kind of like if you were pregnant. We put the jelly on your belly and we look to make sure that you don't have an aneurysm in your abdomen. It has been shown that men who have smoked are at higher risk of having the main blood vessel going down your abdomen being a little bit dilated. It kind of swells up on people. I've ordered that study hundreds of times, and I have picked up a few that did require intervention. And it was a good thing that we did it because we were able to do something about it to get the surgeons involved before it became a big issue.
If you're just joining us, this is Healthcare Unmasked, and joining us today, Dr. Laith Alzweri. He'll be chiming in here in just a little bit. The director of Men's Health and assistant professor of urology at the Division of Urology at UTMB Health, and also Dr. Alberto Guitterez, talking about men's health, debunking some myths out there. And right away, as we got going here, you know, Dr. Guitterez, you were talking about PSA test, and Dr. Alzweri, I know you are encouraged by that as well with everyone. And we talked at the beginning about, you know, the wise convincing. This is one of our viewers, Judy Rouse, saying, my husband had an aggressive prostate cancer diagnosed because of a routine PSA test in 2013 when he was 65. He had no prostate enlargement, no symptoms, but was alerted by the higher than normal PSA test result. By the time her surgery was scheduled, that PSA had increased to 23, just jumped up there. And she puts it, he is lucky to be alive. Men need to submit to the annual exams. Dr. Alzweri, I'm sure you're agreeing with that 100% here today, are you not, sir?
Yeah, I mean, yeah, absolutely. I mean, thank you for the opportunity to talk to I-45 now, and to in collaboration with the UTMB. You know, we are from the community to the community, and we want to raise awareness about men's health. You know, cutting to the topic, definitely, you know, PSA is an important test. Generally speaking, like my colleague, Dr. Guitterez, not every man needs PSA. Generally speaking, we say if you are above the age of 40, you need to think about it if you have symptoms or problems with passing urine. The other two risk factors are family history of prostate cancer in a first or second degree relative. So if a father, grandfather, you know, uncles, siblings have prostate cancer, older or younger than a man, then he should be checked. And also African-American men have twice the risk of, you know, having prostate cancer when compared to other ethnicities. So definitely, you know, if you have symptoms with, you know, problems passing urine, waking up at night, then you need to have the prostate checked. If you have family history, it should be done earlier. And by the age of 50, I think it would be a good thing to do. Now, guidelines are, again, you know, kind of, there's some controversy whether we should do it for every man or not, but I think it warrants a discussion with the doctor or urologist.
Gotcha. And since we are talking about men's health here, let's go ahead and have you chime in on this. When we talk about men's health, what are we talking about outside of the general, you know, sense of just general health care? What are we talking about that are kind of male specific that we need to be talking about?
So, you know, as you alluded earlier, you know, women are smarter and they live longer because they look after themselves. Men, they don't. So when we talk about men's health, we talk about conditions that specifically affect males, mainly enlarged prostate. I'm talking about urology. I mean, enlarged prostate. We talk about prostate cancer. We talk about testicular cancer. And then we talk about sexual health, which is low testosterone and erectile dysfunction. Those are the broad terms. I mean, obviously, we work in collaboration with my colleagues like Dr. Guitterez, because if somebody has a heart disease or high blood pressure, they will come to me with erectile dysfunction. So it's a mirror image, you know? So right. Everything at the end will come and affect the general well-being of a man.
One of the things is we, as you said, you were talking about, you know, you worry about the heart disease, prostate cancer, the high blood pressure, and the high cholesterol. That comes into play with all of these. You said something here I found very interesting is that, you know, they may go into Dr. Guitterez and be talking about, you know, oh, I have this issue or I have this issue, but you'll find that one issue here, you go and check and you find that there's other issues associated. How often do you see when you hear about one particular issue, it's actually there's something else related to that as well?
I mean, to me, that's very common. It's not very unusual that I'll be the first doctor that a man would see at the age of 55 simply because he has low testosterone or erectile dysfunction.
Mm-hmm.
So I have a good discussion with him, about his problem. Then I ask him, do you have a primary care doctor? And if he tells me no, then I say, well, you need to have a doctor. So every man is important for his family. If NFL players and, all these footballers have managers, every man should have a manager. You should have a primary care physician or a urologist to look after you. So because every man is important for his family. So if somebody has erectile dysfunction and he hasn't seen a cardiologist, I say, go and get your heart checked. Go and see the primary care physician so you get your cholesterol, your hypertension, your diabetes under control.
Yeah, and you say they have to have a good manager, a good coach here. That goes to one of the challenges y'all both identified here is that a lot of times guys think they can play through whatever it is. You're not feeling good. They have a little bit of pain or something like that. They see, an athlete, because they're heralded. We just saw that in the NBA playoffs last night. A player who's been out, came into the game, got everyone hyped up and, overcoming adversity. It's a lot different in real life, though, when you're doing that. How do you overcome that challenge right there of, hey, listen, trying to play through it's not the best option here for you?
I'll tell you one thing. So most people would have investment for retirement. Is that correct?
Right.
How do you do that? You chip in something every month for a long time. Why? Because you may need it at the end. If you have all the money in the world and you're not in good health, you're not going to enjoy it. You're not going to be there for your family. So I tell them investing for your retirement is very similar investing in your health. It's a series of small, painful decisions every day that will have a great reward at the end.
Yeah, Dr. Guitterez,
you just need to chip into your health, do the right decisions, surround yourself with friendly doctors at UTMB or anywhere else, doesn't matter, but we have to start somewhere. We're not invincible. We're flesh and blood. We're not machines.
And that goes to what you had said earlier, Dr. Guitterez, is that it's conversation, talking to someone like they're human, not statistics. Right? It comes down to that. But no, go ahead.
I was thinking a lot of times men do show up and they're frustrated that their energy level is not what it used to be, and they're wanting me to fix that so they can, move on with whatever it is they need to do. And again, I tell them, if there's a fire under the pot and things are steaming over, then maybe we can put a lid on things to provide some temporary relief. But if the fire is still going, by the time we get the lid off, we're just going to have a bigger problem. We need to uproot the issues. We need to make sure that your habits are not contributing to this, because if we try to address it by putting patches on it, you're just going to get frustrated down the line. It's going to stop working.
Which goes to something that that we have here, Dr. Alzweri, you provided to us. I wanted to take a look at it here. This is talking about pop culture and stuff. If I'm driving on the road, I am hearing everything from come to the testosterone clinic, or you can come in here. We got this supplement. We got this for you. We got this so you can lose weight. And it all comes down to, quite frankly, it says, so you can, without saying it directly this way, I bet you're going to have a better sex life if you do this. Can you address that kind of pop culture stuff
absolutely.
The pop culture of healthcare?
Yes, absolutely, TJ. I mean, it's all of us, including me, if I can get from A to B the quickest way, I'll take the quickest way. But sometimes the quickest way is not the best option. So in pop culture, it's all about, men with six packs and, the perfect physique and being very energetic, perfect on everything, which is essentially non-existent. If you look at statistics, about 52% of men between the age of 40 to 70 have some degree of erectile dysfunction. A quarter of the adult men of the US have low testosterone. Probably more than 50% of men above the age of 50 have problems with enlarged prostates. So it's very common. And that's where the marketing comes is for these men. Some of these options may provide a short-term solution, but in my experience, and Dr. Guitterez can shine some light as well, it's they put a band-aid on a big wound and they come too late when it's very difficult for us to fix. And I'm sorry to say that most men will service their cars more often than they will see their doctors.
And you bring up a great point with that about seeing your mechanic more than you do on your car. And Dr. Guitterez, you and I talked about this at length yesterday, and Dr. Alzweri, you as well. But the fact that it comes down to is that there's this kind of wall, and that's part of why we're doing the show today, is to get men, not just people, right, men to get past this wall of just talk it out and get to it. And it becomes something that because if you don't, it's going to be more serious down the line to do so. Dr. Alzweri, I mean, particularly in urology, and what you say is that almost everything kind of leads back, but when by the time that you may diagnose something within urology, it can be pretty serious if they don't get in for those general checkups too, correct?
True. So for example, let's talk about, here you put the kind of definition of our program, which is, we do research, education in all aspects of men's health. And we're part of a society, the Society of Sexual Medicine North America, which is a group of providers who specialize in men's health in collaboration with our primary care colleagues. So if we were to take an example, for example, erectile dysfunction. So a man comes with erectile dysfunction to see me in clinic 5 years down the line after he's had the problem. He tried all the supplements. His risk of having a fatal heart attack or a stroke is about 50%. So it's not only just that problem, it's reflection of the well-being of the heart. So, and I tell men, if you're feeling tired, if things are not, perfectly well in the bedroom, or, you're not being very well, that's your red light engine going on saying you need to get checked.
It's the canary in the coal mine.
Exactly. And that's a perfect slide. It's just the canary of the coal mine. That's your sign that, aging is not a statement of decline. No, it's of adaptation. If someone is either not getting older, they're getting better in adapting with life. And we want to partner with you to improve your quality of life. And, and in all men's health, conditions, it basically reflects general well-being. When you talk about risk factors, and Dr. Guitterez already alluded to that, which is aging, chronic diseases, hypertension, diabetes, heart disease, medications that treat these conditions may cause problems, with low testosterone or, difficulty with erections, lifestyle, alcohol, smoking, lack of exercise, and stress. Or, stress specifically is very, common for all of us. This slide is very important just to show you that, according to CDC, if you look at the percentage on the right-hand side of the screen, how many people are obese or have diabetes or hypertension or high cholesterol over the last decade, it goes without saying, nowadays it's much worse, unfortunately. So as a nation, we have to work harder. The main problem is in the blood vessels. Do you see these yellow sparkles in the wall of the blood vessels? That's all your cholesterol making the blood vessels harder, which put people at risk of heart attack, strokes, and erectile dysfunction. And now I just want to show this slide. It's very technical, but the top slide is the artery in the penis. It's about 1 to 2 millimeter. It's very narrow. The one in the heart below it is 3 to 4. Then the one in the neck, the carotid, is about 5 to 7. The one in your leg is about 6 to 8. So if somebody has a weak erection, if the small blood vessel is blocked, what's happening to the bigger ones? They're at risk of getting blocked.
And it goes back to what you said earlier. If you're seeing something here, there's probably something further back
exactly
you're looking at right now that needs to be addressed. And it always comes about, it needs to be addressed early. If you really get to it, acting late can really, it set you up for something in not too distant future, correct?
Absolutely. As I told you, within 2 to 3 years, people may have heart attacks and strokes. And I'm sure Dr. Guitterez, sees this in his practice as well.
Yeah.
So I do want to chime in on a little bit of a positive note. Even if you are having these symptoms, there's still quite a bit we can do for you. People are afraid to come. Maybe they don't want to hear how bad it's gotten. Maybe there's a bit of shame or something along the lines of that. The only place that my brain is going to go to when you show up is, where are we at and how can we fix it? and I'm going to get to it right away.
Right.
And I'm going to show it to you, and explain it in very simple terms that you can understand. And that alone empowers men to start doing the right things. It's never too late. In fact, most of my patients who come to see me, in their 50s or 60s, who haven't seen a doctor in a long time, they end up being my favorite patients. They start making these small changes that start adding up very quickly, and their outcomes will reflect that positivity.
Because that's part of it is we talk about weight loss, for example. If folks don't see an immediate response, or they don't see themselves going from 300 pounds to 150 pounds in a day, they figure it's already not working. But really what you're able, from what I'm hearing you saying, is that very small things you can do early on, you start feeling better. You're starting to feel better, and particularly for men on these things. What are some of the tips you give to folks, both of you give? Start with you, Dr. Guitterez. What tips do you give men just to say, all right, do this so you can start feeling better?
So always at the top of my list is smoking. Now, men who smoke and are not interested in quitting, I usually don't try to get into it too much. It's something that I feel like I try to earn their trust on other matters first before we try to tackle that, because it can be a big one. But whenever I see men who smoke, that's, to me, problem number 1, number 2, and number 3. We can give people medication for cholesterol. We can give people medication to try to get their blood pressure under control. But at the end of the day, those cigarettes, they just have so much harm in every single one of them that doing away with them, it would almost be preferable in of itself than doing all these other things. So I just ask them, well, does your wife smoke? Are y'all doing it together? No, it's just you. Or yeah, it's her. Okay. Have you guys talked about trying to quit at the same time? Have you ever tried to quit in the past? Again, it's a conversation. I try to see what the barriers are. I try to offer some solutions for how to tackle that. I discuss the medications, the options that are available. And very often, at least we get people to cut back significantly, which also makes a big difference. It doesn't have to be perfect. We just have to try to make sure we're moving in the right direction.
The big thing too, I think we've seen this kind of change in the medical field too, not be preachy about it, more of a, let's have a conversation about it, correct?
Yeah. And if they show up at their follow-up visit and they tell me, no, I'm still smoking a pack a day, I'm not going to shake my head or shake my finger or anything like that. I'm just going to say, oh yeah, how come? Did you try any of the things? Yes, no. Why not? How come? And if they say, you know what, doc, I'd rather not talk about it, that's fair enough. I tell them, I'm going to bring it up in the future though, because it really is important. And they usually say, well, that's fine. But like I said, very often, once we establish a good relationship, no topic is off the table. So it's very important to get in, if anything, just to establish that relationship with someone.
We're going to do a little bit. We'll talk a little bit about urology here in a little bit. But we did talk about, we wanted to bust some of the myths that are out there, and both of y'all can feel free to chime in on this. But this is some, I find it interesting just reading through these, Dr. Alzweri, so you can help me out with this. It says, myth, age doesn't affect fertility, but tight pants and hot tubs do. That's a pretty easy one, right?
Well, age does affect fertility. The quality of sperms as men are, get older, the quality of sperms are less. So the chances of pregnancy is less. But theoretically speaking, a man could be fertile, if he's healthy into his 60s and 70s. Theoretically speaking, it's possible, yes. Now, tight pants and hot tubs, basically the design is that the testicles are outside the body, so they're cooler, by half a degree for the testicle to be able to produce testosterone and sperms. If it's too warm, it will impair its ability to do its function. So if somebody is in the sauna like 3-4 times a week, and they put laptops on their on their legs all the time, it may affect negatively. Yes.
Yeah. So there is with some part. Now here's a part. This is going to be a little internal thing for my my good friend Chris Gonzalez, who works there at UTMB Health, works in the communications office, worked for me, the Galveston Daily News. I made fun of his man bun all the time. And I always said, your hair is going to fall out because you keep putting your hair in a man bun. Is that true or not here? I've got to know because we see it a lot. But it seems to be working out just fine for most people out there, because hair loss is the other big thing guys worry about. Is the erectile dysfunction and the hair loss. Those are the two big things that come up.
I'm not aware of any kind of relation. I don't know, Dr. Guitterez, do you want to add on it?
No, I don't remember it ever coming up in medical school or on my board exam or anything like that. That is not true. If people are worried about their hair loss, it's actually women that usually tell me they feel like their hair is coming out in clumps. There's a few things we can check, but oftentimes everything comes back normal. We can check your thyroid function. Some men like to take more biotin and things like that. But generally speaking, I believe hair loss is attributable to a genetic component.
And here's what I know we're going to be talking about in October, but we're talking about now is that there are people who say, oh, well, breast cancer is only a women's issue. While not a high percentage, that's not accurate. Men also get breast cancer.
That's true. Yes, it's very rare. They do get it, and if somebody notices a growth in the breast, then they should get checked.
Gotcha. And I found something else that was interesting here too. And this kind of goes to what we were talking about with pop culture and the like. And we see about supplements, the protein shakes, the everything else. This is going to make you stronger, more viral, and the like. And I was hoping, Dr. Alzweri, you can kind of address that, because there are so many products. You go into these kind of supplement stores and they'll say, hey, this is good to help your fertility. This is help to last longer. And again, it all comes down to, without saying it directly, that this is going to improve your sex life. It's all hinting at that. Yeah. And the way those commercials go. Can you talk about the workout supplements and protein shakes, what effects they could have on you in the long run? Because there are some dangers out there and risks that folks need to pay attention to.
Absolutely. That's a great question. So what I tell patients is that the original design of a human being was to eat what they found on trees or plants, or hunt. And then we learned how to plant things. Generally speaking, too much protein is not good for you. If you are someone who is regularly exercising, your recommended daily allowance or requirements of protein would increase by 20 to 30%. But when we talk about protein intake, it doesn't have to be all meat, and doesn't have to be all supplements. You can have different natural forms of protein, whether it's in meat, red and white, and other forms like legumes, from like a vegetarian protein. The one thing that caveat about all these supplements, people should understand, they are exempted from being regulated thoroughly like medications. And there have been studies where some of these supplements were not, very rigorously checked. They do have contaminants, whether it's heavy metals, and sometimes they might have some toxins, which is not good for the person. So generally speaking, if you have a balanced diet, you need to increase your recommended daily allowance probably by 20 to 30%, but not more. If you take too much protein, and Dr. Guitterez probably see this in his practice as well, it's harmful to the kidneys. So you go from being healthy to being unhealthy. So generally speaking, I try to advise against it. If somebody trusts some kind of product, then it's at their discretion.
And that kind of leads into my next thing, because it goes into the whole, what should men be taking? What should they be healthcare? Dr. Guitterez, what if I came in and sat down with you today and said, all right, I'm feeling lethargic on a daily basis. Sure. What are you going to tell me, like right off the bat, outside of to get more sleep, which is something we hear?
The first thing I'd want to know is, what is your day-to-day like? I want to know, how many hours are you sleeping a night? Are you feeling rested when you wake up? Do you have to wake up multiple times at night to use the restroom? Is that interfering with your ability to sleep? There's a lot of men out there with undiagnosed sleep apnea. They're waking up and they feel like they've been run over by a truck, that's something that needs to be addressed. And then are they setting some time aside to take care of themselves? Are they doing some exercise? It can be anything. It can be just going for a walk a few times a day, maybe walk the dog or something. Are you doing something to ensure that you're staying reasonably healthy? So if that is a problem right off the bat, if they admit that they don't sleep much, or they don't exercise, or they're at work too much and they don't have time to do those sort of things, right off the bat, I tell them, well, look, I am going to check your labs, and there's a few extra things I can check. I can check your thyroid. We can check your testosterone. Now we'll check your blood counts, your metabolic panel. But if at the end of the day, it's your habits that are keeping you from having the amount of energy that you would like, then it doesn't really matter what I do or what I give you. It's not going to change how you feel. Maybe momentarily it could, but you're just going to get frustrated down the line. So it's important that we be honest and that we try to come up with a plan to address those things. It doesn't have to be, a grand scheme. We don't have to move a mountain. Like I said, small steps can really make a difference. I also talk with men about their diet. A lot of times it's, what are you doing that you really shouldn't? Me personally, I really try to tackle sugar, especially in drinks. Coca-Cola, Dr. Pepper, juice, orange juice, all of those things have just an overt amount of sugar. Putting those things in your body with so much frequency, it's just going to cause your pancreas to be releasing a lot of insulin. It's going to send your body into storage mode. And even if you're doing other things that are healthy, like exercising or trying to eat more salads, again, you're just going to get frustrated. That amount of sugar is really going to be a detriment to you being able to achieve your goals.
Gotcha. And you bring into something I wanted to kind of touch on too. It doesn't have to be a grand scheme, but one of the things I found very useful for me is that when my general practicing physician also communicates with the rest of, you want to call it team, that's one of the benefits of, for example, of working with physicians at UTMB, is at least, my chart and everything that you don't have to have files sent over. It's readily accessible. How important is that to have that communication amongst general practitioner and then your specialist afterwards? I want to get both of y'all's input on that.
I mean, we work in teams. I mean, it's, we refer patients to each other. We have many mutual patients. As I told you, like if we take the athletes example, we're like your managers. We're like your coach. We are here to work with you. And number one is we need to identify the problem. And when we identify the problem, it's 50% solved. If you know what you need to deal with, and you know who your coaches are, who your managers, who your doctors, people you can trust, then we're on the right track. And no matter how late they come to us, we are here to work with you as a team. If we are at the stage of prevention, Dr. Guitterez will do a great job. If they come to me and it's a few years down the line and they need anything up to a procedure, like surgery, we are well equipped to do that. So this, wherever you are on the journey, whether you're just starting or you're having some problems, just come and talk to us. We are here to help you.
And that's what it comes down to, is that communication that matters, to get someone in and make sure that they're doing that. And it goes to the question that both of you heard from me yesterday, is COVID-19 particularly. A lot of folks weren't seeing their doctors on a regular basis unless they had some extreme issues or if they had COVID itself. And those practices of about a year or so of folks of not seeing their doctor on a regular basis, not scheduling those appointments. Dr. Guitterez, let me ask you, how big of a problem are you seeing that right now?
A lot of people did fall off the boat, as they say, but it doesn't matter. I mean, as soon as I see them, sometimes it almost looks like they're ashamed to be back, or they're afraid that I'm going to check their markers or diabetes, or that their blood pressure is going to be high. I might just crack a joke just to break the ice. I'll tell them, where have you been? I've been looking everywhere for you. But then we just get right back to it. No matter where we're at, we can talk about what happened over the last year. what things had to change, whether we were able to exercise still, if getting good quality food or sticking to our habits became a challenge. I'm going to ask if that's changed, if there's something I can do to help, and we will make adjustments to the medication, and we'll probably repeat labs just to see where those are at.
And the big thing is, you said it earlier, this is not going to be a scolding session.
No,
You haven't been there for a year. You haven't been there even 2 years, 3 years, even. That's important to know. No one's going to chew you out. No one's going to, gripe at you.
TJ, I was going to say.
Yeah, go ahead.
Yeah, I was going to say, I see men with between two brackets, embarrassing problems, below the waist, embarrassing problems.
Yeah.
And some of them have had a problem for years. Before they went and saw Dr. Guitterez, they mentioned it to him. I said, hey, man, I know someone who can help you. No, this is actually common. So number one is you are not alone. If you're having a problem, many other people are having the same problem. And guess what? There are people who are specially trained to look after that. And, even if you came late, I think it's better than never coming, because we can make things better, definitely.
Right. And we don't want to, shame anyone into this. It is important. As you point out, you're not alone on that. And it gives us a chance now, Dr. Alzweri, to talk about the urology team at UTMB, one of the top ranked anywhere out there. Talk about that, but what all is there, because folks may be confused too what urology actually is. Because unless you're having to see a urologist for your particular treatment, you may not know the breadth of that.
Absolutely, sir. Thank you, TJ. So urology is a field of medicine that treats the urinary tract. So the kidneys, the tubes between the kidneys and the bladder called the ureters, the bladders, and in men and women. So we look after the urinary tract symptoms in men and women and kids, all age groups. Then we also specialize in reproductive, like fertility and sexual problem in men, which is like my area. So we cover in a wide spectrum of issues, like problems, people who have enlarged prostates, problems with passing urine, waking up at night very often. If they feel tired, then they have, low testosterone. Kids who have issues with their kidneys, women who have urine incontinence, people who have cancer, kidney cancer, bladder cancer, prostate cancer, testicular cancer, and we provide all the top-notch advanced cutting technology options, robotic surgery, lasers, minimally invasive same-day procedures, and when we talk about the men's health clinic in specific, we have all the what I call precision medicine tools. So if somebody comes to me with a specific problem, I do a test that gives the patient a blueprint of their condition. Then they can choose among different options. For example, if somebody have erectile dysfunction, you can treat that with medications all the way up to surgery. So how do you know what's the best option? We do an ultrasound. So we take history, do physical exam, and then do a specialized ultrasound test that informs the patient. We are here to work with you as a team, give you all the information, empower the man to make a decision. And one last thing, when we talk about urology and men's health, we're not talking about just young men. We talk about fathers, husbands, sons, loved ones, significant others. It's the other half of the society that we want to be in a good shape and a best quality of life for themselves and their families. And I just want to also reiterate, small changes for big gain. Just like you invest in your retirement, invest in your health. We will encourage all men to have regular checks up with their primary care physician or a urologist. If you have depression, if you're feeling low, if you have cancer or have chest pain, these could be symptoms of something serious, and we should not ignore the red light engine. As I said before, we need to go check. It's never too late. We can start with small steps, like eating healthier, doing some physical exercise every day, and then build up. We have to think big, that in 5-10 years, where I want to see myself. For every man, I want to be there for my family. I want to be the best shape I can be. It is possible, And when do we act? We act now. If you are on this call, if you're seeing this video, please, just make the decision to make some changes, and we're here to help you. And again, as you said, TJ, don't see your mechanic more often than you see your doctor. I don't care how expensive your car is, but your most precious asset is your health.
Yeah, it's hard to drive the car around if you're sick.
Absolutely. Yeah, absolutely. Yeah, you won't enjoy it.
I'm talking about. I should point out, Dr. Alzweri, your fan club is joined us here today, too. Sherry Bogar chiming in here today. She says you rock. I should point out as well. Out there as well. I always like to get you a good comment. And if you want to learn more about Dr. Alzweri, we had the link on our site there too, but you see the link there on your screen, and Dr. Guitterez's link is right there as well. We've been talking about men's health and going through trying to debunk some of the myths out there and really encourage you. And I think the most important message we probably got from today is one that we heard from Dr. Guitterez, which was, don't think you're going to come in and get scolded. You're not. It's just, that's not the way it's done nowadays. And that's what we want to encourage folks to do. In fact, let me just tell you, folks, I'm pretty active in my healthcare. I don't always follow my doctor's advice. My doctor is Dr. Sood at UTMB Health. She doesn't gripe at me. She gives me the side eye a little bit every once in a while, but it's more of a comical thing with her than anything else. And but yeah, I mean, but I do misbehave. I don't always follow the instructions. I'm like every other guy that's out there that goes through. And yes, I'm one of those where my wife is the one reminding me, hey, have you gone to see your doctor lately? Hey, and that's why she has access to my chart. And that's one of the things you could do as well. Ladies, if you're out there, you can get a proxy access to your husband's my chart and set up an appointment for him. If he gets the reminder, he may think, oh, I forgot I did that, and go in. You never know. Final thoughts from each of you. First up, you, Dr. Guitterez, before we wrap up here today.
Just go ahead and come and see us. It's not too early and it's not too late. No matter where you're at, we are going to get to the bottom of it all. And if you're great, excellent. I'll see you next year. And if you're not, then, let's get to it. We will roll our sleeves up, and whether we struggle or things are smooth sailing, it'll be a journey that I'm happy to take with y'all.
Gotcha. Dr. Alzweri, how about you?
Yeah, I would say that, someone said, he believed he could, and so he did. So I think today, every man can take a small step to, get better, act now and think big about the big picture, how he can get better. And when you decide to see someone, just look for a friendly doctor or urologist, start the conversation. We have an open door policy for everyone. And no matter how embarrassing the problem is, there are many people who have the same problem, and there are doctors who are trained to deal with it. And we are here to help you and to achieve the best care that you and quality of life that you can get. And it's not only Guitterez and Alzweri. There's a huge team of nurses, doctors, staff. It's a huge team here at your service.
And while this says urology on here, any issue, but as I said, while today we're emphasizing men, make sure you make the call 409-772-2222 or toll free 800-917-8906. You can call day or night, and someone can get you set up on an appointment and are encouraging. And you can check it out there and make sure you do so. Gentlemen, thanks for coming on. We appreciate it. It's a topic we could do hours and hours and hours on, I know. And trust me, two of you are good enough. We're going to be able to do that. There's been just a little behind the scenes, folks. We've had Dr. Guitterez is going to step up and he's envious of Dr. Alzweri's slideshow. So we're going to have the two of them. I think we're going to have a little. We got to get some competition going here.
I mean, we work on the same team, TJ.
No. It's been great having you two on. I'm joshing around with the two of you because it is good that. The information we're getting out there is important to folks, and it's been good to hear. I know for myself, and I know, as I said, we've had mainly the wives chiming in here. As I said, as I'm watching the comments, and that's the way it goes. But ladies, if wife, girlfriend, however it is, significant other, go to the man in your life and say, hey, go make an appointment. We just had the number up there. And they can get you in at UTMB Health. Thank you both for being on today. We appreciate it.
Thank you. I just want to say that we're more than happy to come again for anything that you want. And we're always available for our community because, we can only do this because of our patients and people like you who want to raise awareness. So that's
Right.
our mission, is to improve quality of life for our community.
We appreciate that, and we'll be bringing you both back on. We're going to get a little more specific on some topics down the line. We wanted to have kind of an overall discussion, narrow in on certain things now. One of the things we want to talk about is prostate cancer, which we didn't get to talk about in more detail here today, because that is an area of concern for men. We need to be talking about that prostate health as well, and that'll be something we'll be working on. And I did have a text from someone personally that asked if we do a special on erectile dysfunction on its own. And I know, Dr. Alzweri, that's something that you want to do. We did a piece with you. In fact, we're gonna re-air that piece we did with you a couple of months ago on that subject matter, on one of the topics there. So that's going to be airing here soon. So thank you, gentlemen, for being on with us today. We appreciate it. Join us again next month, folks, as we get into July. The hot months are here with us, and we'll be talking about a whole various subjects here the next month or two as well. And don't forget to join us Saturday, by the way, down on Galveston Island for all of our coverage of Juneteenth. That's coming up as well, presented in part by UTMB Health. I'm TJ Alds, I-45 Now.